Endometriosis is a painful condition that affects every 1 in 10 women during their reproductive years. This month, a reminder to not ignore the symptoms and seek medical intervention. During Endometriosis Awareness Month, we'd like to welcome Dr. Jessica McLaughlin, Reproductive Endocrinologist with Coastal Fertility Specialists. It's great to have you.
Thank you so much for having me. I think this is such a great opportunity to really shine some light in women's health, women's fertility, and a great chance to talk about endometriosis.
Most definitely. And just remind us, give us a brief education, if you will, on what endometriosis is.
So endometriosis is a very common disorder. 1 in 10 women are affected. And what it is a condition where normal tissue that usually lives on the inside of the uterus grows in abnormal locations. And that can be on the outside of the uterus, in the abdomen, near the fallopian tubes, on the bowel. It can really kind of be in different locations. And so what happens each month is that normally this tissue is shed from the uterus and women have a period. But during that time, if this tissue is located in an abnormal location, those little implants can also bleed, and that's what causes pain for women.
What causes it exactly?
So there are many theories about what causes endometriosis. The most common theory is something called retrograde menstruation, which I know sounds like a very funny concept, but really in 90% of women, usually the tissue and fluid, comes out from below when having a period, but actually it can go back through the fallopian tubes, and that's how it gets into the abdomen. But for most women, this is no big deal at all, and this tissue and fluid is reabsorbed. And we don't know why, but in a small subset of women, this tissue will implant and stick, and that's really what endometriosis is, this otherwise normal tissue, but certainly in an abnormal location.
Now, there are some women who are asymptomatic, so they don't ever really experience pain or notice that they have it. Is it dangerous for it to go untreated?
So you're right. For some women, they can have endometriosis and be totally asymptomatic. For other women, they notice the kind of classic symptoms, really painful periods. But for some women, only the presenting symptom is actually infertility. And so, that can be something if women are experiencing infertility, something to see a physician about, because you may have endometriosis. With endometriosis, 30 to 50% of women have infertility.
So for people who are experiencing infertility, that would be one symptom of it. But for people who, let's just say that they are experiencing those painful menstrual cycles, that they are finding discomfort in that area of their body, if it does go untreated, could that potentially lead to something more serious?
So when women have, the symptoms of endometriosis, we really think about them in two groups, those that are trying for pregnancy and those that are not. Of course, if we're not trying for a pregnancy, why we want to treat endometriosis is to give women symptomatic relief.
I see.
But this is a precancerous condition. This is mainly to help women's symptoms, which in one regard may just be painful periods, not trying for pregnancy, or in another regard, maybe women that are trying for pregnancy.
I see. Well, with just about 30 seconds left, treatment, how do you excise it? Do you go through surgery? And are there any treatments on the horizon to prevent it altogether?
So when we think about treatment options, again, we divide women into those that are trying for pregnancy and those that are not trying for pregnancy. Surgery is a great option for those not trying for pregnancy, and women will get pain relief with that. But when we are trying for pregnancy, we actually have nice studies now demonstrating that surgery doesn't increase fertility rates just on your own, or actually with our fertility treatment.
I see.
So when we have infertility and endometriosis, here at Coastal Fertility, we recommend a thorough fertility evaluation, importantly, to see if there's any anatomic disruptions from the endometriosis. But then there are different treatment options, to consider, something called an intrauterine insemination, or actually, what bypasses really the environment on the inside of the uterus is in vitro fertilization. And so we, encourage women, if they know they have endometriosis and trying to conceive, to talk with your doctor.
Absolutely. Dr. McLaughlin, thank you so much for joining us. Really good information.
Thank you so much for having me. Have a good day.
We're back in 2 minutes.